As a pharmacist, if you're new to Medicare's care management programs, annual wellness visits, or AWVs is a great program to start off with. AWVs offer an opportunity to improve and expand patient care while acting as a gateway to other Medicare programs. In this video, we'll discuss the many benefits pharmacists can gain from providing this valuable service. Hey, this is JP from ThoroughCare. We offer software to help pharmacists work with providers to simplify care management services like annual wellness visits. With pharmacists facing DIR fees and lower reimbursements on medications, Medicare's care management programs offer opportunities for additional revenue while addressing gaps in patient care. Pharmacists are uniquely qualified to assist with these programs and can do so through physician-pharmacist partnerships. So what exactly is an AWV? As the name suggests, an annual wellness visit is a yearly assessment of a patient's current health. Keep in mind, an AWV is different from a routine physical exam or an E&M visit. For most patients, the vast majority of their health status is identified through acute care encounters and general medical evaluations. An annual wellness visit goes much further in helping paint a clearer picture of the patient's overall condition, leading to improved care planning and enhancing the probability of improved outcomes. The overall goal of an AWV is to establish a record of the patient's physical and mental well-being for the purpose of preventative health planning. The visit reviews health history, notes current providers and prescriptions, takes routine measurements, provides a cognitive screening, sets a screening schedule for appropriate preventative services, identifies potential issues, and answers any questions. By participating in an AWV, a patient will receive a personalized risk prevention plan targeted for specific conditions relevant to their situation. AWVs are also entirely free for anyone covered by Medicare Part B. Pharmacists can offer AWVs through a partnership with a primary care provider. While not recognized as billing providers, pharmacists can collaborate with providers to manage a program. Keep in mind that any services performed by a pharmacist must be billed under a recognized provider's NPI number. Many healthcare providers are pressed for time. Providers are performing annual physicals, so dedicating additional time to an AWV can be challenging. Additionally, many physicians do not have the staff to manage the service on their own. That's where pharmacists can lend a hand by working under the supervision of a physician to provide AWVs to their patients. So why are AWVs valuable for pharmacists to offer? First, AWVs provide a generous reimbursement that can help offset revenue losses. Depending on the AWV provided, the national average reimbursement is currently about $166. Keep in mind that this rate could vary based on your area. Next, AWVs are designed as a preventative health screening tool. With this in mind, AWVs are an opportunity to enroll individuals in new services, including chronic care management or remote patient monitoring. For example, if during an AWV assessment, a patient sees hypertension as a priority for treatment, it would be the perfect opportunity to review the benefits of chronic care management. Enrolling these patients in additional programs will further engage patients on a month-to-month basis by targeting specific diseases, and each of these programs are reimbursed as well. An AWV is also the perfect opportunity to have an advanced care planning discussion, which is another reimbursable program for end-of-life planning. An ACP sets up a living will to specify the patient's preferences for their end-of-life care. When an ACP is provided on the same day as an AWV, patients are also eligible to receive this consultation without the need for a deductible or coinsurance. Since AWVs are free to patients and fully covered by Medicare, there is a low barrier for entry. Medicare wants to use this program to increase access to preventative care. Now let's talk about why pharmacists are well positioned to offer these programs on behalf of providers. 90% of people in the US live within 5 miles of a pharmacy. Patients interact with their pharmacist up to 12 times more frequently than their primary care physician, allowing more opportunities to introduce the program to them. The trusted relationships that pharmacies build with their customers are vital to the continuity of care. The vast majority of eligible patients are not getting AWVs and don't understand how it differs from their routine doctor's appointments. So having a trusted source walk them through the program can help to get them to enroll. Many patients simply aren't aware of this service. When patients hear that conducting AWVs will give them personalized care and prevent future trips to the doctor's office, they're more likely to enroll in the program. Parts of the AWV can be conducted prior to the pharmacy visit, so it can reduce the amount of time the visit will take. Software solutions can also help streamline the process by automating tasks, simplifying risk assessments, and analyzing patient risk factors to generate clinical recommendations. So as you can see, annual wellness visits are a great service to provide for patients and can offer many paths to increased revenue. If you'd like to learn more about AWVs or other care programs, including the rules, regulations, billing codes, and current reimbursements, you can watch those videos right here. Or if you're interested in how ThoroughCare can help, reach out at the link below. Please like and subscribe to our channel to learn more. Thanks for watching.